Hi, I'm Elizabeth Hess. I'm here with Julie Pryde. She is the administrator of the Champaign-Urbana Public Health District. Thank you to Urbana Mayor Diane Marlin, as well as Jason Liggett. He's our producer for getting this set up. Julie Pryde and I are in different locations because, of course, we are sheltered at work, sheltered at home. Thank you so much for joining me today, Julie.
Thank you.
My first question is about the personal protective equipment. You keep hearing about shortages, but last time we spoke, you indicated that Champaign-Urbana is in good shape. Where are we with this?
Well, I think we are where a lot of places were at one point. So we have enough PPE right now, but they are still using the conservation guidance, if you will. So it's like a matrix of things that how to use it, when to use it. It's not 100% like it would be if there wasn't a shortage, but it's going along okay. What is always concerning is, will there be enough PPE if cases really get high and we can't keep the curve flattened?
What number are we officially at in Champaign County right now?
21. There's 21 cases reported currently. That number will change. We update it at the end of the day after we get contact tracing done. So, it'll undoubtedly go up today at 4 when we update our numbers on our website.
I have heard that Carle is now doing in-house testing. How is that different to what they were doing, and how does this work?
Okay, so before, when they were doing testing, it had to go to either the Illinois Department of Public Health lab, or it had to go to another lab like Quest or LabCorp, a private lab. So now through a partnership with the University of Illinois and Carle, they have the ability to actually do testing in-house in their own laboratories, which means that it will be a lot faster. So the results will come back in hours rather than days. So they can batch them and run a bunch at the same time. So that's good news for our community.
You say 21 now. That's 21 confirmed, officially designated testing. Correct. Should we assume there are many more cases out there and still shelter in place?
Absolutely. We are just seeing the tip of the iceberg right now. So it's easy to assume that there's at least 10 times that many, if not more. A lot of people that are sick are remaining at home, remaining isolated, and they're not testing. That's because they don't need to go into the doctor. They're not required to be tested or not urged to be tested. So a lot of the people that are being tested are people that are sick enough to go through the hospital system.
And I've heard that Chicago is considered a, quote, hotspot. What exactly is a hotspot? And we're pretty close to Chicago. What does that mean for us?
The hotspot just means the number of cases. Any community can be like that. It's where I think a good way to put that would be that they are starting to exceed their hospital capacity, which is what we do not want to do. So overwhelming the healthcare system. That's when you start seeing the other things open up, the surge facilities. I do like to remind everyone that all hospitals have plans for surge capacity, whether it is for a pandemic or whether it is for a mass casualty event like a tornado or some kind of large scale accident or something. So the plans are in place. We would prefer not to have to use them if we could keep everyone in place and not infecting each other. That would be the best case scenario.
I've seen cities set up emergency hospitals in Central Park, for example. How far are we from having to do that?
Well, I hope we're very far away from having to do that. But, so the cases are going to keep going up. It's certainly over the next couple weeks. And our hospitals have already expanded their capacity internally. So they're doing every single thing right, every single thing in their plan. So that is good to know. And, we're different than a lot of places because we have 2 healthcare facilities here. We have a lot of space. We have the University of Illinois. A lot of places, if you look in the rural communities, they may not even have any hospitals around them. And if they do, it's a regional hospital, and a lot of people go there, and there just aren't a lot of staff and things. So there's concern for those areas too. And even though Chicago has a lot of hospitals, they have a lot of people.
I've only left the house twice in 2 weeks, Am I overreacting, or is this exactly what we're supposed to do? Go out for only essentials?
That's exactly what is supposed to be happening. It's not happening everywhere. You should not be leaving the house unless you need to go to the store. And ideally, if you can do it in such a way where you can pick up your order, that would be better. So you only go out. You don't go out because, oh, you decide you want chocolate muffins this afternoon. You go out when you actually need supplies. You go out, you get them, ask a neighbor if they need them, get them for them as well. You know, the fewer trips out, the better. Stay away from people and stay in your home. Do not meet with friends. Do not have parties. We're getting reports of people having parties. That's absolutely not meeting the purpose. Just because you're in your home, you do not bring other people into your home. You have to think of it as that is your quarantine space. You don't want anyone coming or going out of that space at all, except for your immediate family unit that you're there with. A lot of people are not taking this seriously enough, and we're going to see cases increase. And that's concerning. So again, stay in your home. Mayor Lightfoot is really getting frustrated in Chicago because people are continuing to congregate. They just shut the lakefront down. I mean, I would like to think that people are mature enough to obey this type of guidance that they're given. It's because it's for everyone's benefit. And so I would like to think that people will do that here, and that we won't have to have an overwhelmed healthcare system. I mean, that is the entire goal of this. And so we need people to take it seriously, to call out others. If you know that they're doing it, remind them, hey, don't have everyone over just because you're having a birthday party. Birthday parties are not going to happen now. You have to come up with alternative ways to do things. And it is absolutely important. A birthday party can cause an outbreak within the people at the house. Just because you love someone, or just because you work with someone, or just because someone is your friend, does not mean that you can be around them. Assume that you are infectious, and assume everyone you come in contact with is infectious, because this does transmit asymptomatically. That's how we have to act until this is over.
Julie, the 2 times that I have been out have been to pick up groceries. I popped the trunk, I had them sign my name, I had them put the groceries in the car. When I got home, I took everything out, and the CDC guidelines say that the virus can live on metal and plastic up to 72 hours and cardboard up to 24 hours. Should I be using Clorox wipes, soap and water? What should I be doing with my groceries?
Putting them away, and then throwing the bags away, and then washing your hands really well. And if you had them on the counter or something, just go ahead and clean and sanitize your countertop. No, you do not need to wipe everything down. Again, just because the virus is on something, as long as you're not getting it into your eyes, nose, or mouth, then you're not going to have a problem with it. So when you go to use the groceries, at whatever point you use them, feel free at that time to wash your hands after you pick it up. If it's the milk jug, just think about everything could potentially have virus on it. So what you're needing to do is clean your own hands to prevent getting that in your eyes, nose, or mouth, because you will be the one that inadvertently puts it in there. So just constantly think about hand washing.
Once I am talking to somebody, my next door neighbor has a nasty cough now. Is it 14 days from the time that I'm anywhere near them until I can go out, even if I'm asymptomatic?
First of all, don't be anywhere near where you can hear your neighbor cough. Stay away from them, number one. But no, I mean, this is a thing where everybody has got to start thinking of themselves as potentially infectious, and everyone around them is potentially infectious. So as uncomfortable and as unusual as it is, we have got to do that. We have got to stay away from people. Don't be within 6 feet, 10 feet. Don't be around them if you don't have to at all.
Okay, we are all wondering the same thing. How long are we going to be social distancing, sheltering in place? Yesterday, we got federal guidance that at least till April 30th, possibly June 1st. Does anyone know if we're trying to reschedule family events? Does anybody know?
No, no one knows for sure, of course, but like I keep trying to remind people that this is going to be a long-term event. We might not all be sheltering in place for the entire time, but you will be, the virus will still be there. and there will be the potential for people to get infected as long as we do not have herd immunity. So herd immunity will not be reached until we have a vaccination. And that's a long way off. That's a year, a year to a year and a half away. So there will be likely be periods of time where the virus is not circulating as much. And again, the idea is to keep the hospital system from becoming overwhelmed. So if there just happens to not be a lot of cases for a while, it may be able to be relaxed some. I just don't know, because we've got federal guidance, we've got state guidance, and then of course we could have local guidance as well if we were having something specific going on in our own community.
I don't think that.
But I do suggest people, I've got a daughter that's getting married in September, and I've told her, I told her this in January, it's probably going to need to be postponed, and that's hard. That's a hard thing to do. People have put money down on things, you have plans there, but really everything's being canceled or postponed. Well, not necessarily canceled, but postponed. Everything from weddings to funerals, birthday parties, everything, because we cannot gather at this time.
Is there ever a time, and I need you to remind me, I know you've told me this off camera, that we will feel normal again? Because this feels like a grieving process right now.
There absolutely is a time that we will feel normal again, because pandemics always end. This one will end. It absolutely will end. It is, I think the reason why this is so different is because very few people alive right now have ever gone through anything like this if they weren't alive during the 1918 pandemic. Of course, that was a whole different time period as well, but yes, this is very unusual times, and it's going to have to be the new normal until it's over. And that is going to be different. But I am always amazed at the creative things that people come up with, the different ways we're doing things. I've seen drive-by birthday parties. I've seen really neat things being done outside of long-term care facilities to cheer people up. People are hanging hearts in their windows. I think whereas it's very unusual and that we are all isolated in one sense, we're coming together in another, which I find very encouraging and very, it's just a very positive thing. And, pandemics change societies. And one thing that we may come out of this is that it has slowed us all down, and it has made us wonder exactly what do we really need to go back to? Like, what are we doing now that's better? And what are we doing that we really missed that we can't wait to get back to? For me, the hardest part has been not being able to be around all the little kids and babies in my life. I mean, that's really hard to do, for a lot of people. I'm just thankful that we have such things as internet and Zoom and all these cameras on everything, because, that's at least letting us communicate with people on a different level. But, you can't hug someone that way. But we just have to come up with new ways. And then when it is over, and it will be over, then, there will be a lot of celebrating going on.
We have a lot of information out there that's coming at us. Not all of it is true. We don't know how to vet it. The one source that I trust is Champaign-Urbana Public Health District, because you do vet it and you're not going to put it out there unless it's been confirmed. What are some of the best ways if somebody just wants to log on and look up information from your agency?
Well, they can go to our website. We try to keep that updated as much as possible. The guidance is changing all the time. So if we have something on there, a month ago, it may be different this month, and it may be different next month. We're trying to get that stuff off of there and keep it current. Centers for Disease Control, Illinois Department of Public Health, those sites are always going to be updated. There's a lot of stuff being spread around on the internet, which is true. I mean, it's true information, and it's a lot of stuff about different studies that are going on. What I do want to caution people is that during this type of crisis situation, all the studies that are going on are going to be posted, whether they're peer-reviewed or whether they have been replicated or whatever. And the idea of that is so that other places can try to replicate them and to see if these are really good. So we try to put information out there to help people understand that, because that's important to know. But you know, your healthcare providers are keeping up on this as well. So whatever the guidance is at the time, if someone were to get sick, that's the guidance that you'll be getting.
One of the things I've noticed is people are kinder to one another. The few times I've taken my dog out, people are excited to see other people. We are very appreciative of all the people on the front lines. So maybe this has changed in our DNA for the better.
Well, I think one thing that is going to come out of this is that neighbors are starting to check on neighbors and pay attention to neighbors. You know, I think that this summer we're going to see people sitting on their front porches, and even if they don't have a front porch, they're probably going to drag their chairs out to the front yard just so that they can have some distant but interaction with people. And in that sense, I think that's a good thing. People are reaching out, always asking, you know, how are you doing? Stay safe, things like that. And that kind of stuff is important. And if you know someone who is living alone, or you know someone who may be struggling, I just keep encouraging people, reach out to them. You don't need to be their best friend or to do that. Just reach out. I mean, people appreciate that. And I've heard some amazing acts of kindness going on. You know, there's really good people out there, and people are creative, they're innovative, they're, for the most part, people are kind. So just continue doing that. Our healthcare workers and first responders and people working in grocery stores, be especially kind to them. They're working under a ton of stress. Even, you know, for the most part, I think people are being kind to the drive-through workers and people in grocery stores and that, but we occasionally hear some stuff. And I think that the negative stuff probably has to do with the people that are being angry or being nasty are probably stressed. So I just encourage everyone to try to, try to recognize that in yourself. Maybe you're nervous, maybe you're anxious, reach out and try to talk to someone about that. There's a lot of resources in our community. We're very, very lucky.
Julie Pryde, I'm going to hug you the first and the longest when we're done with social distancing. Thank you so much. Julie Pryde, Administrator of the Champaign-Urbana Public Health District. Thank you so much for your time.
Thank you.
Thank you again to Urbana Mayor Diane Marlin, Jason Liggett for making this happen, UPTV, the City of Urbana. Thank you again to everyone at the Champaign-Urbana Public Health District. Everyone stay safe.